Hello, welcome to GVCC 2021. Thank you for making the time to be with us today. We are really pleased to have you here and join in on today's session on metastatic. Now what? You can interact with questions via the chat throughout today's session, as well as the Q&A. Please remember also that all of our sessions are meant to be informational, and any treatment decisions should be made with your healthcare team. That said, again, thank you very much for making the time to join us today. I'm Brad Love. I'm a GRIT co-founder as well as a caregiver and cancer researcher at the University of Texas, and I'll be moderating today. Let's start, if we may, by learning a little bit more about our panelists. Once we've had the chance to learn about their backgrounds, we'll get into some discussion questions where we welcome your contributions and spend time discussing this profoundly under-discussed topic. So I would go so far as to say this may be the most important GVCC session we have because of the need for the kinds of dialogue that's going to happen over the next hour with our panelists and with you. That said, Cynthia, may I ask you to introduce yourself for a few minutes?
So good afternoon. Thank you for, as you said, thank you for spending part of your Friday afternoon with us. I'm representing metastatic patients. And so I'm going to give you a little bit of my story so you know where I'm coming from. One thing I've learned is there are tons of flavors of cancer, tons of flavors of people. So I want to give you my perspective. While I'm doing this, if in the chat you want to give me a little about yourself, maybe one word that describes you other than cancer, something you want to define you, how many years metastatic, and what flavor of cancer you have. My answers would be runner. I've been an athlete all my life, 1.5 years, and metastatic breast cancer. So my story begins as the pandemic was hitting in 2020. I was diagnosed with de novo metastatic breast cancer, or MBC for short. De novo means right up front or right out of the gate, which meant I never had early stage cancer that has a 70% chance of cure. Mine was spreading to other parts of my body before it was detected in my breast. Only, there's varying numbers, maybe about 6% of us are diagnosed with de novo metastatic breast cancer. And metastatic has no cure, as you know. At the time, I was a third grade teacher after 7 or 8 other careers, which included traditional engineering, using my mechanical engineering degree, several technical support roles, restaurant owner manager, a consultant trainer in ground penetrating radar technology, lots of variety. And then finally teaching was to be my final career, and I love teaching. But the pandemic made a challenging job 10 times harder. So luckily, I didn't have to face teaching in the pandemic. So stressful. I was able to retire early as I got this diagnosis. You may have heard people say, or you may have experienced it yourself, that managing cancer care is at least a part-time job, if not often a full-time job. It has certainly been that for me. At first, I only told a handful of people. It took about 6 months for me to process it emotionally to the point that I could tell my whole family. And it's only been in the last few weeks that I've become more public with everyone about my diagnosis. This opportunity gives me a chance to even extend that more, and I really appreciate it. This disease, at least for me, is as challenging emotionally as it is physically. This last summer was particularly difficult because I did not have the proper medical team in place. It took a while to realize this, and Dr. C last night, if you attended, said it's often when there's a challenge that we find out we don't have the right team, and that's what happened with me. It took a while to find out who was right for me, and then even more time to actually make that change. And time is not something we have a lot of. Having a great medical team on my side has been extremely valuable already. Just this week, I learned I have progression to a new part of my body. And because I have a super responsive medical team, who acted immediately, it's so much easier to accept this time. But I also have put in place a support system around me. I talked about my family earlier, my close-knit friends. I've also reached out to Breast Cancer Resource Center here in Austin, Texas. That's where I'm at, by the way. And they have wonderful patient navigators. They have a wonderful metastatic support group. And the community is amazing in supporting me. When my MBC is only a part-time job, the things I like doing are volunteering for Breast Cancer Resource Center as well as some other charitable organizations in town, helping family and friends with whatever they need help with, traveling, hiking, running. I hope to do a 5-mile turkey trot coming up Thanksgiving, partner social and performance dancing, and advocating for this disease as much as possible. My quality of life, as you can see, is still very good. And when I get bad news, I try to think, how do I feel right now? And if I feel good, I try not to let cancer take any more from me than it already is taking by rehearsing the tragedy ahead of time. Profound words a support group member shared with me. Cancer may lessen how many years I have left, but I will try to preserve as much happiness and quality of life during that time as it is possible. And believe it or not, that's the quick version of my story. I'm sure y'all understand.
Thank you, Cynthia. We can just sit with that for a minute, and we appreciate you sharing that in its power and wisdom and importance. Lisa Ann, could I ask you, please, to share a little bit about yourself and thank all of you who are actively sharing in the chat already and responding to Cynthia's words, just as we will do for Lisa Ann and Sarah.
So good afternoon, everyone. I'm feeling super blessed and grateful to be here. I am a patient navigator. I'm a hospice volunteer, and I'm also an end-of-life doula. I'm trained through ANELDA. But the main reason I'm here on this panel is that I was a caregiver, a primary caregiver for both my mom that I lost to metastatic breast cancer in 2017 and my dad that I lost in 2020. And I am such a proponent for hospice care. Sarah, yes, it's just without hospice, I couldn't have done what I did. So being a caregiver is very challenging, but when you have all the components that can assist you to make it a bit easier, it's phenomenal. Thank you for letting me be here. This is wonderful. And your great words, Cynthia. You are an inspiration.
Indeed. And thank you, Lisa Ann, for sharing the overview of your story and more of that to come. Sarah, could I ask you to offer an overview?
Thank you for having me today. I really feel very blessed to be a part of all of this. And Cynthia, your words were very inspiring. I am a social worker. I have been a hospice social worker / palliative social worker for 15 years. I worked for our local hospice as a discharge planner at a couple of local hospitals and represented our agency. So a lot of my work has been concentrated in working with metastatic patients and their families. I have worked doing bereavement support and worked with children and adults. Have worked specifically, I've worked with parents at times who are metastatic, worked with their children to help them cope. A few years ago when I had my son, I decided to go part-time. So I worked at a local hospital as part of the palliative care team. So I was still able to have involvement with hospice, but was part of that team for a few years. And now I am part of a palliative consultant connected to United Healthcare called Prospero Health. And I experienced the loss of my aunt, my beloved aunt, a few years ago from pancreatic cancer. And she survived from diagnosis about almost 2 years. So it was pretty incredible, her strength and her will. But I have a passion for this work. I find it so purposeful to be there with people to help them live and focus on that daily living and quality of life every day. So I feel very grateful to be a part of this conversation today.
Thank you for making that work happen, Sarah. And thanks, obviously, for being here today. Cynthia, if I might, I'd like to pose a question in your direction, but please feel free to defer, and there are other guests and other questions if timing feels off at any point. One thing that may be helpful for the sake of dialogue, if you don't mind sharing, is what is one thing that you'd like other people to know about living with metastatic cancer and how to treat people experiencing stage 4? Because this could maybe give some of our attendees language to present themselves in the world and have better relationships with loved ones as well as others in their lives.
So I can only say one. So I think the most important thing, and actually, I was so glad I got to tune in last night for a little bit, because Dr. C mentioned this. He mentioned so many things that resonated with me, but he said, if at all possible, when you're dealing with a medical person like himself, tell them what you need. And so I think being able to say what you need, and for me, it's simple things like, instead of someone putting their hand on my arm and looking forlorn and saying, "Oh, how are you?" It'd be better if they just said, "How are you?" You know, plain and simple, and then let me elaborate if I want to, and not elaborate it if I don't. So saying what I need, those people who are responsive to caring for you and supporting for you in the way that you need, those are the real people you want around. Because for once, it's kind of about you, at least for this particular thing. And if I can say two, I'd say, know what you can control and know what you can't control. I can't control what cancer is doing to my body, but I can control getting a really good medical team around me. This week, I found out I had progression. My team didn't miss a beat. They were on it immediately. I have follow-up appointments. I have the things in place that need to be done, and that's all I can ask for. And the nurse who told me about it was so empathetic. She was actually more upset than I was, because I was in science mode and information mode, and she was so empathetic, but so responsive and so efficient in taking care of it. So that we can control who we have. I'm not sure we can control the cancer completely.
Yes, thank you for sharing that. And for the record, you're welcome to share whatever you know is helpful for others, because as I said at the beginning, these are things we don't talk about in the world. So the more dialogue we can have, the better, because the more people we can help and save them some of the steps to get to the point to understand their own priorities or have to develop their own language. Sometimes a script is where the magic is in easing people's burden. Related to that, Lisa Ann, if I might turn to you, who obviously deals with some similar situations. Can you tell us a little bit about your experience with metastatic patients and hospice and end-of-life care?
I'm going to piggyback on what you just said, Cynthia, because so many times when you say, "Oh, we're calling in hospice," people are like, "Oh, you've given up. You've just given up." And it's, no, you're taking charge. You are taking charge, just what you're talking about. It's a profound statement that I'm taking charge and doing what I can. The things that I control, I'll take care of those things. And I see that so often. Just the loss of control, if you can just bring that back in and take care of those things that you know you can put your hands on and do, really, it's life-changing, truly.
Related to that, Sarah, if we could prevail upon your expertise a little bit, Could you explain the difference for the audience between palliative care and hospice?
So the term palliative, people get very confused by the two terms and think they're one and the same. And in fact, the word palliative or palliate means to relieve pain. So when we think about palliative care, we think about relieving emotional pain, physical pain, or spiritual pain. With hospice, it's kind of the same mentality, but a doctor has to think, that has to believe in his best or him or her best guesstimation that a patient has 6 months or less to live based on their decline. And they have to stop aggressive therapies, immunotherapies, in order to qualify. So palliative care and hospice, it's kind of like if you think about an umbrella, hospice is kind of one of the spokes of that umbrella because the philosophies and the thinking are very much similar. But to have palliative care, I have patients that I see now who are chronically ill or have advanced stages, but they're not yet ready for hospice. And they perhaps don't have that 6 month or less prognosis according to their doctor. So that's really the big difference, is that prognostication by the physician or the nurse practitioner. But again, it's the same thought process, that philosophy of care, that looking at total pain, not just somebody's physical pain, but their emotional pain and spiritual pain, which is, hospice does so well with that very interdisciplinary approach for every patient and family they see.
Thank you for sharing that. Could you expand on that a little bit so that
Of course.
our participants can understand why advocating for a social worker being on the care team can be a really constructive thing? How can a social worker help patients and their families during these difficult times?
So the reason that, social work is involved on a palliative care team or a hospice team is really to essentially meet patients and families. One of you said it, Cynthia or Lisa Ann, about meeting patients and families where they're at, paying attention to that emotional component, and not just the medical, not getting stuck in all of the physical, managing symptoms, which is critical, but paying attention to the therapeutic presence, being that emotional support, that neutral person to just process your feelings, your concerns, what's going on, how they're feeling. Perhaps a patient doesn't want to talk to their family, so they utilize you as that layer of support as a counselor. And talking with the families about, processing what's going on with their loved one as they're taking care of them, whether they're in hospice or not, as they're going through treatment, helping them to process their feelings and emotions, that caregiver fatigue, how they're coping in the process. So a social worker really acts as a layer of mainly support, but is involved as essentially like a therapist, if you will, to help. And then a lot of times too, in those instances in my work now, it's connecting to resources, making sure that you're helping the patient and family navigate the healthcare community and the community at large to gather as many resources as they can to not only, to help the situation at large, to make it as best as possible considering.
Yeah. Lisa Ann, could I follow up with you on that point, because you have experience in that domain too? How can someone or their caregiver advocate for themselves and receive access or knowledge about those resources?
So just contacting hospice, and I'm just going from that realm as a caregiver because that's what I worked through, the multifaceted aspects of hospice, just social work, chaplain, nurse, CNA, coming together, the support is phenomenal. You're taking charge and you have a team to help take charge with you. And it's a beautiful, beautiful thing. We were able to embrace the day and not have to worry about all those little things that just were taking away from the beauty of the day. Time was precious and I could concentrate on taking care of my mom, experiencing the best beauty that we could of the day. And then I had the support team that came in and just was phenomenal.
Yeah, I can appreciate that, the coordination.
Mhm.
Cynthia, it's clear from your experience, you have also spent a lot of time processing and doing work and thought about what it is look like to find resources. Could you share tips that you have about how people can marshal resources or be empowered when it comes to their journeys?
Yes, I was about to interject. I was trying to make sure I was unmuted. Um, so it was actually a social worker that put me in touch with Breast Cancer Resource Center here in Austin. And I think I hope there are lots of organizations like them in different cities, different areas, because they gave me a patient navigator right away that she answered questions I didn't even know I had, which for me was invaluable because I didn't waste time looking for answers after the fact. They were there before I needed them. And she's checking on me. She just checked on me yesterday. She's an amazing support person. They have a support group for kind of group counseling. And then I want to make sure I answer your question, but they also give back. They give back to early stage cancer patients, but also the metastatic, and they have a really good concept of how we are different from early stage, and that really means a lot. I just spent a couple of days this week with a lady in my support group who's become a really close friend, Jennifer, and she just signed up for hospice, and it was a struggle for her to do that because she felt like she's taking a step in a direction she didn't want to go. And she lives by herself like I do. She's extremely independent. She didn't want to lose her independence, but she took that step, and to see the relief on her face and to feel the relief in her body and on her face was amazing. She said it was very comforting to kind of take that step. And like I say, it's actually taking control of something rather than releasing control. So, yeah.
Wow, I love that sentence. Taking control of something rather than releasing control. That's so not often how care feels for people. That's a really powerful lens. And to have a team around oneself or one's loved one that operates in that same philosophy to share
Well, I know for me and my friend Jennifer, we've talked about this a lot. We're very independent, and we don't want someone coming into our house. We're introverts too, Brad. And so we want to hold on to our independence and not let go of control. But we've talked about the fact that nobody can do this on their own. It's an impossible task. It's absolutely impossible. So the best way to get through it is to acknowledge that we need help and be able to ask for it and then be able to accept it. And one of the gifts she's giving me right now, and I got the chance to say this with her and her therapist. I was on that call with her where she's actually giving me a gift and kind of letting me see what someone like me may have to go through. And it's a beautiful gift. And so I think it's helping her accept, being able to accept help.
Yeah, that is a powerful bit of wisdom, no doubt about it. To follow from that, a question open to the three of you. What other advice would you give to someone receiving a metastatic diagnosis for themselves or a loved one?
I would have to say, I haven't gone through this myself personally, but going through it with my aunt and doing it professionally, I agree with what Cynthia said. It's taking back control, but focusing on the day, focusing on what's important in front of you, focusing on the present, and just trying to find quality in those days, not trying to look at what's to come. but trying to find purpose in every day that you have. And that's really the key component of, I think that's why I was so drawn to hospice. It's just, not about the end result, but just about finding purpose in our day, which we should all do on a regular basis anyway. But yeah.
Yeah, I've always been a planner. And so to not be able to plan a year from now, or, I've always had a 5-year plan. So to bring it back and be in the day is pretty much the only way I can be happy to any extent right now. It's really hard to learn that. And I will say, earlier in the year when I had progression, I handled it terribly. I panicked. I was rehearsing the tragedy day in and day out. But I also had a medical team that I didn't trust, and there was reasons I didn't trust them, and valid reasons I should change. But I got out of that. And one thing that may be available to people now as kind of a blessing from the pandemic is my insurance company provides therapy, online therapy, and online coaching for free. And I'm taking full advantage of that. And I'm telling them I want to be proactive about the next time I have progression, and boom, it happened. And I feel so much better able to handle it. So again, knowing that support will help, asking for it, accepting it, that's the best we can do.
That's a really key point about the medical providers. I've worked with many, many different oncologists and oncology teams. You have to trust your provider, and that's one of the most important things, is just making you feel secure with the person that's taking care of you. And I can't stress that enough.
Well, and I will say one thing that I really liked about my current oncologist, the first time I met her, she was talking several steps ahead. And for those of us who like to plan, that's the best we can plan. And also, if you have a medical team that's planning for when things will go wrong, go in the wrong direction, a direction we don't want, at least there's no delay in trying to figure out what's next. And for me, those delays are where my head can go to the wrong place, my attitude takes a dive. Those are the scary places. So just, clicking it in, no delays, we're on to the next one. And I don't know if medically it helps, but it seems like it would. Like if you don't let the cancer go too far down the road, it's probably easier to undo it and get it back stable. So have a team that thinks ahead. So let them plan. We might not be able to plan so much, but they can plan and help us be prepared.
Lisa Ann, should we unmute?
And the medical team is paramount. And not only throughout treatment, but when it comes to that point where treatment is no longer an option. The honesty and just holding you close and giving you all of the tools that you need to kind of take that next step, but in a way that is celebrating each day. Like you said, there's beauty for ashes. There really is. There's always something to be grateful for. My mother showed me that right to the very day that she passed. It could have been just as simple as the sun, a breeze through the window, and that is really what we all should try to live in those, present moment only moment. But it really brings it forefront when, like you said, you're not planning for tomorrow. You really need to just kind of embrace the day.
I will say though, there are some days when I need to just stay in bed, cry it out. Mm-hmm. Okay. If I try to fight that off too much, mm-hmm. it's going to last longer. So not all rosy, but
you need to feel your feelings. You need to feel those feelings, because if you don't, they will erupt in other ways.
Yeah.
And I think what you said was perfect, Lisa Ann, about, having a physician who's able to be realistic with you and to be able to have those tough conversations, because even oncologists have a hard time having those conversations.
Oh, sure. Mm-hmm.
Yeah, we have a question in the chat that I think each of you will have some perspective on, and thank you to the anonymous person who posed the question. but you've each shared the importance of the care team. And Cynthia, you very practically made changes in your care team, in fact, as a result of this. And this seems like good wisdom for everyone. So what do you do if the oncologist doesn't discuss palliative or hospice care, but only continues pushing aggressive treatment? What are some things people can do to handle that or redirect it?
I can speak to that a little bit. I've had several patients that this has happened to. It just depends, obviously, on the physician. And the physician, if they struggle, there's always, if you're in the hospital or you have, access to a palliative care team, sometimes that's helpful to help the physician connect that. But sometimes it's just having a family meeting with the physician and talking about, how you feel and where you're at and where your family's at. And having that open discussion of saying, I don't want to continue with this treatment. And most physicians are receptive to that. I think if you have a physician that continues to not be, I think having your family, your support system go with you to back you up and say, this is not working for me. This is what I need to be doing to go forward, to pursue hospice. Perhaps even connecting with the doctor's, nurse practitioner or PA. Sometimes that's a way that I've gone, not to go around the physician, but to go to the physician's team and say, this doctor is not being realistic. We need to look at, the other options because this patient is saying to me, he or she wants to pursue hospice.
Well, and I'm pretty sure that if I get to the point where we're thinking about, if I'm thinking about, I'm not sure I want to go through more treatments, and my doctor's not in line with me, then I'm probably going to get a second opinion, for sure. Yeah, and bringing family members in or somebody who can help advocate and pull that conversation out. Oh, and my primary care physician, when she asked to be copied on my previous oncologist notes, that she became an advocate for me in the background. Just that step on her part, it was amazing what it did. It brought out a lot of things. So
I was going to say, going back to your primary care physician too can be helpful. A second opinion with another oncologist is always helpful. Sometimes it's hard for people to reestablish another relationship with another oncologist to go through that again. So that's why I say, sometimes it's helpful to talk to the doctor's NP or PA, but another physician who knows you and has that established relationship can be a good advocate as well.
I will say, here in Austin, Texas, UT Health is establishing a new center. And when I called them, it was a referral, someone else had gone to them. The oncologist who specialized in breast cancer actually kept appointments available, Zoom appointments available, because she deals a lot in research, but she also likes giving second opinions. So sometimes you'll find facilities or organizations out there that know that people need second opinions, maybe not a new oncologist, but a second opinion, and they facilitate that.
Agreed, if I may affirm that, and specifically working at said institution, it's a really important part of being in an academic medical center. So it is a totally normal question or phone call to get for someone to say, hi, can you look over my file? So, and it doesn't have to be in your geographic area. It may just be you reach out to someone for a Zoom chat who is known as an expert in whatever area. So please use those resources.
I know one of our local GYN oncologists here in Syracuse does a lot of work with one of the hospitals in Boston. She'll get second opinions for her patients in Boston, just because she's exhausted everything she can think of. She will send that information.
Nice.
I'm going to agree with you, with both of you too, about your PCP. Invaluable with my mom's situation. Just having someone that had been with her for years to bounce things off of, invaluable. Someone you really want to pull in.
That was one thing, my current oncologist, when I came on board with her, there were a number of things I was just didn't feel right in the past. And she pulled in a cardiologist, a gastroenterologist, all these specialists. And what I admired about that is she didn't pretend to know everything and be God in charge of my care. She was pulling for a further team into play. And now I have a couple more specialists. It's like specialist-city, but I admire that in her.
My mother would always say it takes a village, and it truly did take a village to navigate. And my mother would call it her journey. Now I know a lot of people think that is not appropriate, but to each his own. But she'd say it just takes a village to just navigate this journey that I'm on.
Indeed. Being a human is complicated in the smoothest of circumstances. If I may, Cynthia, turn back to you as one of the questions we previewed a little bit, but I want to be sensitive about it if now's not a great time for this question. There's such power in other people's stories. It's one of the most core human things in the way we find affirmation and understanding in those narratives. Could I ask you, if now's an okay time to do so, to share with us how you felt receiving a metastatic diagnosis?
This is a perfectly acceptable time to ask that. For me, because it was de novo, it was kind of out of the blue, and so I really was in shock, and it was surreal for a while. And I mentioned in my intro, it took me about 6 months to process enough emotionally to where I could tell my family. I told one sister, and I told 3 very close friends that have been around for so many things in my life. So I had support, but I had to process it emotionally first. Because what I noticed, I went out to tell someone, pretty quick after. And as I told, she was one of my favorite teaching buddies in the past. We were science teachers together, so we have always enjoyed each other. As I'm telling her what's going on with me, my intent was to show her how well I was doing and that it wasn't anything serious and don't worry about me. As I told it, tears are streaming down her face. And I'm like, what's wrong? What's wrong? What's wrong? She goes, my grandmother died of this. So what I realized is, as we tell our story, and then I did it today. I blurted out something to a friend of mine that it made her sad and she's grieving. And I'm like, no, I didn't want to put that on her. So I think we have to grieve enough for ourselves. And for me, anyway, it was that way. And then I can help others go through it. But man, and some people don't have the luxury of time to do all this. And I don't know how I could have faced it without this time to do it. So, yeah.
It is obviously, so please.
Well, I found out my diagnosis on a Friday on a Zoom session before a 3-day weekend. And Dr. Google is not your friend in that situation. So that was a clue that I didn't have the right care team in place. So yeah, it was shocking and something that I definitely needed to process. Yeah. I'm on my 2nd therapist now.
Good for you for advocating for yourself. The emotional labor of this is so profound. And as people are sharing in the chat, as Jacqueline says, and Jen's experience mirroring yours a little bit, the emotional work that is expected of people is so large and often something we are very unprepared for because there is nothing like this in life.
Well, and I don't think it it ever ends. For me, it just feels like a roller coaster. You know, in fact, for my first year, I was in denial because things were going so well. And I thought, okay, I'm going to be one of the unicorns that, you know, lives for 20 years. And so the first progression hit me hard because I wasn't in reality. And we live from 3-month scan to 3-month scan. And so the roller coaster just keeps going.
Yes, understandably. Thank you for sharing that. I'm sure there are a whole lot of people on here today who needed to be able to take that in and understand they're not alone in their experiences, because that isolation can be so powerful and real. Thinking about that theme, Sarah, if we may turn to your social work expertise, knowing that isolation and that internal dialogue and need for support can be so real, what resources do you refer people to that may be helpful to attendees? Or a resource might be just a kind of question to ask the care team to get connected to a social worker or counselor.
Well, in terms of resources, several oncology practices will have their own social worker on staff that provides that layer of support. And obviously, getting that that news and processing the idea of having metastatic disease, I would imagine there'd be an immense amount of anticipatory grief as to what's to come. And so finding, Cynthia, you said you're on your second therapist. So finding a therapist that meets you where you're at and is able to process with you in a way that's helpful. So, resources, I do everything from, group sessions to individual sessions, recommended various therapists. I mean, I know our local, one of our local groups here has 3 social workers that work directly, independent practice. So, there's a lot of different resources out there that people can pull from on the, on the web too. But I think, the key factor for many, I can't say for most, but for many is finding somebody that, like Cynthia said earlier about, just doing this and just, look at, oh, poor you, finding somebody who can meet you where you're at and be able to be present with you in the moment. And, I think that is the key thing that I've come across time and time again, that, people just need somebody to hear them. But in terms of resources, I mean, in different communities, there's so many, the American Cancer Society, there's so many different, obviously GRIT has become a big resource, but just finding a place, a support group too. I facilitated a support group for the Leukemia Lymphoma Society for years. And it was just a place where people could come and meet and talk and process about their lives. So much like Cynthia, you have your friend who's you've been able to connect with. So it was just a place they could connect, and everyone understood how everyone felt. And I think that's, that's the biggest thing, at least to me, is feeling heard. I hope that answered your question. Okay.
Cynthia, if I could just ask you a quick question, because you touched on scans and scanxiety, and that is really a true thing. My mother dealt with that every 3 months. And can you just give yours? I'd like your perspective on that.
So I told myself I wouldn't get nervous this time. But when I showed up for the appointment, I know how scans go, and we'll just do this, and I'm not going to worry about it until, even I meet with the doctor a week later. But it took 20 minutes for the nurse to check me in because the paperwork was all messed up. The doctors, she had doctors assigned to me that didn't make sense. The person who checked me in had her mask down around her chin. And then somebody walked in from the outside without a mask. And I'm like, shouldn't she have a mask? Oh, yeah, take care of it. And then I had to wait an hour because they couldn't get a good stick on the person before. And now I'm going in to meet the same person who couldn't get a good stick. And I kind of lost it. So my best laid plans of not rehearsing the tragedy, it's amazing. When it gets difficult, then all of a sudden you can kind of spin into that. So I kind of pouted that day and then left it. But part of it has been, I'm not gonna rehearse the tragedy. That's my phrase I learned from my friend. But the other part of it is, I've put so many things in my life that are distracting me, but at the same time are things that are really important to me. I don't do anything trivial anymore, only things that are really important to me. So I'm going to just say it right now. This was a godsend this week because I had something to focus on that was important to me and I feel good about. And, things may go downhill next week, but right now I'm present. I'm doing what I want to do. I'm making the most of my life. But I know I'm going to melt in scan offices and lose it again. So hopefully I grieve quickly and get back to life.
Cynthia, a key part of the beauty of what you're sharing, and among the reasons it's so powerful, right, is one can know this, one can accept this, and it's part of feeling feelings. And by sharing that, you've given these other 50-something people permission to have the same journey and recognize it as normal, as needed, and then to figure out how to go on from there.
Yeah, and it's a lot easier said than done. And I think, prior, my friends were telling me that same thing, but I couldn't do it in the moment because I had already gone down that rabbit hole. And so I think knowing up front and then preparing yourself and thinking about the mantras you need to write down or say to yourself, or, for me, that's crucial, is planning that, because I'm a planner, and then hopefully it kicks in when it needs to.
Right. And that's where these dialogues can help. I mean, this is our fundamental mission at Grit, is to reduce isolation, because everyone feels, just by virtue of being a human, so alone when negotiating these situations. But by telling our stories and sharing best practices and sharing resources, we can make that less in the world. It's never going to be easy or simple, but it can be done together. And that's part of what we're seeking to achieve here. I see lots of great advice. And again, exactly this, people sharing tips to support each other in the chat, thinking about the way that for some, group support can be very helpful, and something, particularly with Zoom, we can find online and be very specific with over time. For others, of course, that doesn't work as much because, as the incredibly empathetic Carla shares, sometimes that can get us focused on other people instead of our own challenges. And all of that is real. Thinking about mindfulness, as Jen is sharing, and as Cynthia recommends, which I use as well, the Headspace app as an opportunity. If there are any final tips our panelists have, I'd like to make some space for that. We are approaching the end of our scheduled time, so I do want to do a quick plug based on what we were just discussing to let our attendees know that the next 2 sessions, intentionally, of course, for GVCC are, first, after this is over, we start a guided deep relaxation for well-being session. And then an hour after that, an art session, essentially an art along, as it's called, to help think about this idea of refreshing our brains and making something that we're proud of. That said, I'd like to open the floor, as I mentioned, to see if there is a last bit of wisdom our panelists would like to share.
I did see one question in the the chat. Someone asked,
Please.
do you ever reach a point where you don't have progression and you can stop treatment? Here's what I've seen about that is some women or men, people choose to stop treatment, but it's considered to be a risk that it's going to come back because it's not considered curable. So I've heard of people stopping treatment, but there's always that risk that it'll come back. But that may be a question you want to ask your medical provider.
Okay. Thank you for sharing that. Agreed. And I shared some resources with Jen as well.
Okay.
So, all of that said, I want to thank each of you for being here and for sharing immensely. We are very grateful for your tips and narratives and time together. The same goes to all of our participants today. Thank you for what you've shared in the chat, and thank you for being here as well with us at GVCC today, and hopefully next to spend some time together doing relaxation for our well-being. All these essential things that are part of care, as we have been discussing. And so when this conversation is completed, I encourage you to go back to the GVCC21.com page, and in just a few minutes, a link will open to that relaxation session where we hope we have the chance to spend some time with you being mindful together. So I thank you all and look forward to seeing you in that next session. And I'm grateful we've had the chance to experience GVCC 21 with each of you.